Hello everyone, I'm John Di Sciullo. Welcome to Innovations in Health. I am joined by Dr. David Tambor from the Mini Dental Implant Center of Tucson. Dr. Tambor, welcome to the show.
Thanks so much, John. It's a pleasure being here.
It's good to see you. And Dr. Tambor, we're here to talk about the Mini Dental Implant. And if you haven't heard about it, ladies and gentlemen, this is going to change your life. If you have a dental issue, you want to stay with us because in the next 30 minutes, we're going to talk about something that just absolutely is an investment in how you look and how you feel. Dr. Tambor, let's talk a little bit overview about the Mini Dental Implant, some of the 5 key points about them.
Well, we like to say mini dental implants are 5 times less. They're less invasive, there's less discomfort, less pain, less healing time, less visits to the dentist, and maybe most important is they're less expensive, usually half the price.
That's an amazing story to tell, but let's see what the Mini Dental Implant really is. We have some models that are in front of you. Say somebody has a full set of dentures, and we talked before the show, an amazing statistic about the number of people that actually have dentures.
Yeah, the 50 million Americans currently statistically have dentures in this country. It's an enormous issue for the country. It's an enormous issue for dentistry. And we finally have a cost-effective alternative to dentures, and really ideally be able to get rid of dentures.
So let's take a look at someone who would have a full set of dentures and how the Mini Dental Implant can change their life. Take a look at one of the models.
Well, we've got, first of all, the best one to look at first is a lower denture. And the reason that a lower denture is I think the one to look at first is because it's the loosest fitting, the most challenging for patients to eat with, to function with, even to keep in their mouth.
Well, and you have all the gooey goop that tries to keep it together, and people just sort of get used to it, but it gets into your system, it tastes terrible. Ugh.
It's true, and the goop is the only way a lot of times it'll keep it in people's mouths.
Yeah.
And I mean, if you've ever had I had a grandmother come in who literally went to hug her little child, and the denture fell out on the floor.
Yeah, how embarrassing.
Oh, and she said to me, she said to me, I never want that to happen ever again. And we were able to do this for her, this type of procedure. And what it is we placed 4 mini dental implants in her lower jaw.
And those are titanium posts.
They are. They're actually little, mini refers to the diameter. They're narrower than conventional implants. And they actually get placed right in through the gum into the bone. And we make a lower denture, and it literally snaps on. And once it's on, it is solid in place. Patients can eat what they like. They can eat an apple, they can eat corn on the cob, they can eat whatever they like. This is a really nice, cost-effective alternative for people that gives them the security, and they can get rid of the goop, like you said.
And with the denture, you have the lower, and you can also take the upper as well, and and the palate comes into play as well.
Absolutely.
So you can start tasting your food again. Imagine that.
Absolutely. With an upper denture, where normally the denture would go all the way back to the palate, with mini dental implants, we're able to make an implant retained denture where the palate is cut out right here. And it's a wonderful procedure for patients. Again, cost effective.
And I like how it snaps right in, and it looks so nice.
It does. It's a beautiful procedure. The amazing thing is that we really have been able to develop techniques where we can take it a step further. We've got a procedure called a fix-on-6, where we're able to place mini dental implants the same way, but we're able to make a bridge made out of zirconium, very, very strong and durable. And when this gets put in somebody's mouth, the patient doesn't take it out. So what happens is they wear this 24/7. They come into us as they would normally, twice a year. We take it out, clean it out. If there's anything underneath, if the little O-rings that are inside need replacing, we replace those. And it's like getting your teeth back. It's really a phenomenal procedure. Also, pretty cost effective. The last alternative is where you don't take it out ever. And we place mini dental implants in the entire arch. And this, again, is made out of zirconium. It gets cemented into place. And I mean, it's literally as strong as anybody's teeth can be.
And that's as permanent as it gets.
That's as permanent as it gets. And probably half the price of the conventional all-on-4 restoration that's out there in the marketplace right now.
And let's take a look at the bone, because the mini dental implant takes away some of the long-term issues that a more conventional implant would have. And if you show us the bone, you'll see that the little hole, there's a big hole there and a little hole, and the big hole is the old implant and the little hole is the mini dental implant.
With conventional implants, which by the way, work great, have worked great for many years.
But the technology is such now, we're moving away. We're into something brand new.
There's something that is really making it like a dinosaur. Instead of having to do, as we did with the old-fashioned, cutting the gum and peeling it back and drilling a very big hole in the bone, screwing in this screw and then suturing it all back up and then waiting 4 to 12 months.
Sounds horrible. Why would anybody do that?
Well, because that was what was available.
That's what was there.
But now we can literally place a pinhole right through the gum, don't have to cut the gum or do surgery, and then we're able to screw these mini dental implants right in. They're self-tapping, so they screw right down into the bone, and you can see that it is a much smaller, you almost can't see the hole there. It's just a revolution in terms of a procedure. Interesting, I'm calling it a revolution. I placed my first one 17 years ago. So we know they work. And
you've been a dentist for many decades.
31 years. And statistically, mini dental implants have the same success rates as conventional dental implants. So it's a wonderful, wonderful procedure.
So if you're out there, ladies and gentlemen, here in Tucson, in the Arizona area, and you want to connect with Dr. David Tambor, the website is TucsonMiniDentalImplants.com. And first of all, where are you located, Dr. Tambor?
6026 East Grant Road in Tucson, about a 1/10 of a mile west of Costco.
And give us your phone number.
It's 520-298-6026.
All right, and we're going to keep showing that number as we go through innovations in health, because it's very important. If you're out there and you're listening and you're thinking this might be something that I need in my life or in the life of a loved one, you know, that's okay too. Somebody can suggest a consultation. Is it a free consultation when they come to see you, Doc?
It is. It's a complimentary consultation. And it's funny that you said a loved one. I can't tell you the number of times where somebody comes in for a consultation and they say to me, oh, I got to get my husband in here too. And they'll literally come back a week later with the two of them sitting in the chair and talking about it, because nobody can believe that they can actually get this wonderful benefit.
It is that life-changing. And it's, as you said, the 5 easy pieces of this are important to remember, that it's less invasive, it is less discomfort, there's less healing time, less visits to the dentist, and most importantly, it's less cost.
That entire combination of things are exactly what people are looking for.
So let's talk about some of the patients that you've worked with mini dental implants and in your practice overall, because you have general dentistry, I would think.
I do, and I've been doing all of it for many, many, many years. The mini dental implant cases, in the early 2000s, we got FDA approval for doing mini dental implants for crowns, bridges, essentially all forms of restoration in dentistry. And I can thank Todd Shatkin up in Buffalo. He was the guy who Todd and his dad did the research on this and got the FDA approval for that. We started doing the cases, these denture retain cases, did a bunch of them, and they were great. They were fabulous, and they still are great. Actually, one of the early implants I did was a 13-year-old girl who was missing a tooth from birth. And we were able to put an implant in that spot and built up around it, and literally in one visit she walked out with a tooth, and she had for years been missing that.
I think that's an important point to bring up, because most people, when they hear of the dentures and the discussion of dentures, there's an automatic maybe stereotype that, well, this is something for senior citizens, something for something for someone a little bit older. But in reality, it's a procedure that anybody of any age can participate in, because look, let's face it, there's a sports injury, somebody's playing a sport and they have a tooth that's knocked out, or there's some issue, or like you said, there's some congenital piece or something that happens in someone's life. It doesn't have to be someone who's a senior. It certainly can be, but it's not limited to that.
No, I think you're absolutely right. And in fact, sports injuries occur and congenitally missing teeth occur, but many, many more people lose teeth because of gum disease or because of a failed root canal or a terrible cavity. Many, many people, many more people. And in the old days, we would put a bridge there where we grind down the teeth on either side. It was costly, it was damaging to the other teeth. Worked, and it worked actually pretty effectively, but how much nicer to be more conservative,
Sure.
to save the other teeth, to do something that doesn't require nearly the kind of invasiveness, and it's less costly for the patients, it's been a fabulous option.
So let's talk about some of the patients that you've worked with. What is their reaction? You know, what was the reaction, say, of the 13-year-old girl, or maybe the senior citizen that you've worked with?
The 13-year-old girl cried. She couldn't get over the fact that she had a tooth there. She had been
so fast.
Oh yeah, I mean, this was, you know, kids had made fun of her. It was in the front, it was down here in the bottom, and kids had made fun of her, and she was incredibly appreciative, and so were her parents.
Yeah.
You know, the grandmother, crying is very common. A lot of people get very emotional about it, and I don't think I don't think any of us realizes how significant this can be for people, but it is. It's enormous. It really does change people's lives. People who wore dentures and really struggled with gagging, and you cut the palate out on that denture and you put it in their mouth, and they just can't believe it. People come back and they tell me, I'm tasting food for the first time in 15 years.
And you wonder why people accept, I guess, the fact that they were just sort of living like that, and maybe it's because of something they think, well, that's just the way it is, but it doesn't have to be that way.
I didn't know what to expect. I've waited approximately 30 years for my teeth, because everyone else comes first, as a mother of 2. But now it's time for me, and so I saw Dr. Tambor on a morning show here in Tucson, Arizona, The Blend, and he came across so calm and collected, and like he wanted to help me. That's what I felt, so I called that next day and set a consultation. And then a month later, surprise! Thank you, doctor, from the bottom of my heart.
If you're watching and you're in Arizona and you're thinking, I need to go and see Dr. David Tambor, you can do that. Mini Dental Implant Center of Tucson. The number is on the screen. The information is on your screen, TucsonMiniDentalImplants.com. You have a great comprehensive website that discusses all of that. So when someone comes in for their free consultation, I'm coming in. I've seen now Innovations in Health. I've seen you on television. I'm going to come in and see what do you talk to the patient about in the consultation? You find out more about their dental history?
Yeah, the first thing I'm always doing is I'm asking them about their history, and I'm asking them, what do they want? I'm most concerned in what people want. I'm not interested in imposing some standard or ideal on them. I really want to know what people want, what their goal is. Sometimes people just really want to eat well. They want to eat better. Sometimes people want their teeth to be beautiful. They want their teeth to be whiter. Sometimes people just desperately don't want their teeth falling out on the floor when they hug their grandchild.
My granddaughter was getting married, and I thought, I can't eat at the wedding. My dentures come loose. But not anymore. My dentist has mini dental implants that stabilize my dentures. Less invasive, less discomfort, and less healing time than conventional implants. And half the cost, too. It was all done in one treatment visit, so I was ready by the wedding.
See Dr. David Tambor at Mini Dental Implant Centers of America. Find out if mini implants are right for you.
Thanks to the minis, I ate with confidence, and my dentures stayed put.
A lot of times I'll say to them, if I gave you a magic wand and you could just go ding, what would you have? How would you want your teeth to look and feel and function? And then I let them go, let them talk. And that really gives me a good sense of what they need and what they want.
And it should be noted too that Dr. Tambor does this procedure right in the office. So
Absolutely.
This is not something where you get the consultation and figure this out, or how many teeth you need, or what the denture is like. Everything is handled in your office, and it is handled within a day.
I've been doing CAD crowns that are crowns in one day for about 17 years as well. When we do these mini implant crowns for a single tooth, if you come in, literally we can place in one visit, place the implant and fabricate the permanent crown, not a temporary, the permanent crown, and cement that on in one visit. So in about an hour and 20 minutes, you can walk out where you were missing a tooth, where now you have a tooth.
It's a life-changing event, just like that.
It's tremendous. And people don't realize that it's available. And it's interesting because the technology's been out there, but they don't realize it's out there. So one of my desires is not just for patients to be able to come to me, although certainly I'm happy to help everybody, but I'd like for the whole dental community to really understand how valuable this technology is, how valuable this technique is, so that patients can benefit from this.
Well, it's important that you want to share that. I think that's terrific. But we should mention too that you're one of just really a few dentists in Arizona that has the mini dental implant procedure available in your office.
It's true. When patients come in, they tell me, my dentist didn't know about this, and they just don't. And I'm happy to be able to take care of as many people as I can. But I also think it's great if we can share this with everybody professionally.
Well, so if someone's out there now and they're watching in Arizona and they're thinking, well, I'm going to come over and I'm going to see you at your office over there on East Grant Road. They're going to come in and they're going to say, okay, it's available in a day, it's latest technology, this must cost an enormous amount of money, but it really doesn't. And you're able to work with the patient.
Yeah, it doesn't really, it's amazing that when people hear what the cost is, and we do have financing, which really helps people a lot. We have a couple different companies that we work with that give short-term interest-free financing.
And I think what's important to note is this is an investment in you, not only in how you look, but in also how you feel. And dental health is so important to your overall health that this is an investment that could add years to your life on so many levels.
You're absolutely right about the importance for our health. I think that we've all heard we are what we eat. And I think that if you aren't able to chew your food up adequately, that's the first part of digestion. The first way that the body starts to take all the nutrients from our food is effectively chewing it up. If you've got crummy fitting dentures or you're missing teeth, you're not chewing your food up as well, you're swallowing it, you're not getting as much nutrition. A lot of our older patients struggle with that. And that's actually, I'm glad you brought it up because it's really an important point, that being able to chew your food well and get adequate nutrition makes a big difference. To drink Ensure or something like that is not giving you the nutrition that you can get.
Certainly not in the long-term basis, that's for sure.
No, that's exactly right.
Yeah. Well, and I think too that, look, I've had some dental work done. I'm not afraid to admit that. You feel better about yourself, particularly if you're in the professional industry. If you're out there and you're looking for a new job, or you want to sort of move forward in your career, you want to move forward in life, having that confidence is very important, I think. And having a smile is very important. Like you were talking about the grandmother that lost the denture, and I'm sure that there were probably some hesitation moments with their family. You don't want to maybe participate in certain family functions, or you feel a little tentative about doing something. This eliminates that.
Absolutely. You're eliminating embarrassment.
Yeah.
Embarrassment is not a good feeling for people to have.
I had a retainer with 2 fake teeth. Not cool. It covered the roof of my mouth. Food would get caught underneath. Couldn't feel hot liquids. One time I burst out laughing and it flew right out of my mouth. Not anymore. My dentist has mini dental implants. After 1 treatment visit, I walked out with 2 teeth, ready to use. And they were half the cost of conventional implants. My dad liked that.
See Dr. David Tambor at Mini Dental Implant Centers of America. Find out if mini implants are right for you.
My retainer went right in the trash.
I think what you said also about the self-confidence, and even in terms of looking for a job, if you have a good-looking smile, we know statistically, research shows that people that have good smiles, that show a happy visage, they are more well accepted and more likely to get a job position. They're more appreciated by everybody around them. It's whether we like it or not, it's a fact of life.
It is a fact of life, and you shouldn't look at this as something that's sort of a selfish act. Well, I'm spending a particular amount of money on a mini dental implant. It's very important to do. If you're just tuning in, you're watching Innovations in Health. We're here in Arizona in the great city of Tucson with Dr. David Tambor, Mini Dental Implant Center of Tucson, and your website, TucsonMiniDentalImplants.com. Very easy to remember, TucsonMiniDentalImplants.com. If you go to the website, there's all of the information you need about where to find Dr. David Tambor, all of the testimonials from some of your patients, and the background on what we're talking about, which is the mini dental implant. If someone is just joining us, or maybe those who have been with us, and I think it's very important, again, to show these models. We've talked about dentures, we've talked about some of the dental procedures, but let's start with that first model again. You have that denture, you've got it, it's on the lower. What are you going to do?
Basically what we're doing is and this looks like pretty much of a standard denture, and it is. In fact, if you come in and you've got an ill-fitting denture, depending on the denture itself, if it's thick enough, I can retrofit that denture to a brand new set of mini dental implants, and that's an even more cost-effective way.
And do you take the existing denture that the individual has, or do you create something new to snap in place?
I can use the existing denture if it is strong enough and if it's in good enough shape. The nice thing is we can place the mini dental implants, use the existing denture as a temporary, so you don't have to ever walk around with missing teeth.
And it snaps in.
And it snaps in. It
so
actually locks in.
That confidence level just in snapping it there. You know, and we like to use an example here in Innovations of Health. If I have my thumb up, sort of that's the titanium post, and the tooth adheres to the post, just like that. So now you've got this strong bond, if you will. Imagine, you know, with the goop and the glue, it's moving around, it slips off, but that titanium post holds it in place, whether it's the full set or just single tooth.
There's actually a ball, a titanium steel ball on the end of it, and there's a rubber O-ring that's inside the housing, and when it slides over the ball, it locks it in. So if you have 4 of them or 6 of them or 8 of them, depending on what you have, it just gets increasingly stronger. And in fact, when you get enough of them on there, it's kind of challenging to take it off, which isn't such a bad. Anybody who has a denture would say, please, the harder it is to get off, the better. I just, you know, if I can't get them out, that's terrific. Obviously, we can get them out, but it's, they really are that strong.
I used to rock and roll and party till dawn. Lately, the only thing that rocks and rolls is my dentures. But no more. My dentist has mini dental implants that stabilize my dentures. Mini implants. Less invasive, less discomfort, and there's less healing time than conventional implants. And it was all done in one treatment visit. Did I mention half the cost, too?
See Dr. David Tambor at Mini Dental Implant Centers of America. Find out if mini dental implants are right for you.
My choppers pop in and I'm ready to roll.
These are American-made products. We should mention that. And this is something that it is manufactured right here in the good old USA, and it's right there that available with Dr. David Tambor here in Tucson. Show us the upper.
Yeah, and I'm with you. I'm really, it's a wonderful thing that they're manufactured in America. I'm a big Made in USA guy, just who I am, and I appreciate it. So yeah, the upper denture, normally this area of the denture is filled with plastic all the way to where my finger would be, and that make people gag very often. They don't taste their food, they can't feel the temperature of the food. With the mini dental implants, we're able to cut this out and make it, and it snaps in place, and it's really, really very, very comfortable.
And in one day, imagine if you're having trouble biting into that ear of corn, a crisp apple. You know, you go to a great restaurant here in Tucson and you don't enjoy the food. Now you can, just like that, and it can happen in such a short amount of time.
It's true.
And let's talk about the single tooth. We haven't gotten to that part and the side teeth, because it's important to note that even though we've talked about full sets, if you just need a few teeth, it can happen just as easily.
Absolutely, and frankly, there may be more people that need that than dentures. I said 50 million. More people are missing teeth than that individual teeth or several teeth. So it's a good point to make. This is a case where the patient is missing 3 teeth in the back, and we're able to literally place the implants and then do a bridge, and the bridge gets cemented right into place, and it looks like you got your teeth back. It functions like you got your teeth back. It's just a phenomenal procedure.
And even if the teeth are in the back, you shouldn't neglect that. You should make sure it's there. It keeps the set full.
Yes. Well, first of all, your back teeth are really the teeth that you use for chewing food. So the front teeth are good for cutting the food, but the back teeth are for chewing food. So we talked before about grinding the food up and chewing it and being able to get effective breaking down of the food. That's very important.
So just because you can't see those teeth that you might have an issue with, it's still very important that you take care of it.
No, and most people don't. A lot of people come in, they're just not concerned about the cosmetics because, well, I can't see them. But But in terms of chewing your food, the other thing that happens is if you lose a tooth and you don't replace it, other teeth shift. So literally, if you had your 2 teeth here with a space, if you don't fill it, these teeth will start to shift like this. And the tooth that's opposing it will start to actually move up or move down, and that can mess up your bite and cause all kinds of other problems.
Let's talk about the fact that this is a procedure that can happen with just 1 tooth as well.
If somebody's missing an individual tooth, and we can place a mini dental implant and make a single crown for it and seat it right on the tooth, and it's as if you get your tooth back. And with CAD technology, which I'm able to do in my office, we're able to do this type of procedure literally in about 1 hour and 20 minutes in 1 visit. You can come in, place the implant, get the permanent crown done in 1 visit.
So it's a single tooth, a few teeth, full set.
Full set, you could do a full, the full set is this one here is literally, this is a case where we put in 12 mini implants, and we've done these. This is called a roundhouse. The implants are placed in 1 visit, and a temporary bridge is placed in the same visit. Typically, this type of procedure takes a few visits.
But certainly a less expansive time
Much less.
than the conventional implant.
I've assisted on the conventional all-on-4 cases, and these cases are really dramatic for patients in terms of the surgery and the healing time, and this is so much easier for people. It's just stunning how much easier it is for people.
This is something that's long-lasting.
Oh, absolutely.
And it's the care of the implant that's still important. You still have to brush your teeth, and you still have to go to the dentist for that, as you mentioned, the gum care and the checkups and everything. But it's not an impossible task to keep the teeth clean and keep the mini dental implant looking good.
No, it's absolutely not impossible. It's actually easier than your own teeth because either you have direct access, like if you take it out and it's very simple to get your toothbrush on it and clean it well, or use a water pick is another great procedure that we recommend. But yeah, you do need to take care of them just like just take care of them well and keep them clean.
It's FDA approved, and I think we should go over the 5 key points here, Dr. Tambor. Less invasive, less discomfort, less healing time, less visits to the dentist, and certainly less expensive. The mini dental implant is what we're talking about. Revolutionary procedure. Technology has moved dentistry forward. Where can we find you, Dr. Tambor?
I'm located at 6026 East Grant Road in Tucson, and it's just about 1/10 of a mile west of Costco.
There you are. And if you're in the area and you want to stop by, it's a free consultation. And the phone number is 520-298-6026. The website, TucsonMiniDentalImplants.com. Dr. David Tambor, it was great to have you here on Innovations in Health. Continued success here in the great state of Arizona.
My pleasure. Thanks very much.
You're welcome.
Appreciate it.